So prior to my interview with the midwife, I knew very little of what the midwife was and her actual role into the delivery and during the pregnancy of a woman. So I reached out to a local midwifery group in my community and I just asked a few questions. What is your role and philosophy as a midwife in a woman's pregnancy? I asked this question because I wanted to gain a better understanding of how a midwife works and how they support a person during pregnancy. Her philosophy emphasized informed choice, empowering the women to make decisions on their healthcare, such as with pain control and whether they want to be delivering at home, and also using evidence-based practice in order to safely deliver the baby's care and the mother's care as well. She also emphasized the continuity of care because in their group, there are 4 midwives that follows the woman throughout her pregnancy so that when it is time for her to deliver, she can be, one of them can be on call. They also emphasized that they work in collaboration with healthcare professionals if the woman is in a high-risk pregnancy. However, if they are low risk, they can be the primary healthcare provider. They can order MRI scans, ultrasounds, and other tests that the woman needs because they are the primary specialized healthcare provider for the pregnant woman during her pregnancy. I also asked, how do you manage to safely care and deliver women if they choose to deliver outside the hospital, such as with a home birth? So she had said that they do discuss the options of the pros and cons of a home birth, but whatever she chooses, that the midwife will support the woman's choice as well. They have admitting privileges in the hospitals. However, if it is a home birth, 2 midwives need to be present just in case something happens so that they can monitor the baby and also the mother. How does a midwife work with a physician? What is their role in the delivery in the hospital? So like I said before, they usually take over the physician if the woman is at low risk pregnancy. However, if it is a high risk, then they do collaborate with the obstetrician. And also I asked what pain options, pain control options, pharmacological and non-pharmacological, do they normally use for home birth. So she mentioned a few things, that there can be no epidural anesthesia because an anesthetist needs to be present for that. But what she finds most useful is a TENS machine and also water and acupressure, deep breathing strategies that they would have talked about prior to the home birth, that the woman would have a chance to review and practice at home before doing the home birth. So that's my interview with the midwife. Thank you.